Question 1. The control framework reveals that when a licensed psychologist in California consults with a psychiatrist in New York regarding a shared patient's treatment plan, and this consultation occurs via a secure video conferencing platform, how should this interaction be categorized within the scope of telemental health services as defined by TMH standards? Option A. This interaction is not telemental health because it is a peer-to-peer consultation between two licensed professionals and does not involve direct patient-provider interaction. Option B. This interaction is not telemental health as it is a professional consultation and falls outside the scope of direct patient care delivery. Option C. This interaction is considered telemental health if it involves the discussion of diagnostic information or treatment recommendations for a mental health condition, requiring adherence to relevant state licensure and privacy laws. Option D. This interaction is telemental health solely because it utilizes a video conferencing platform for remote communication. The correct answer is C. This interaction is considered telemental health if it involves the discussion of diagnostic information or treatment recommendations for a mental health condition, requiring adherence to relevant state licensure and privacy laws. Explanation. The control framework reveals that the definition and scope of telemental health services are critical for ensuring compliance with the board's certified telemental health provider (TMH) standards, which are rooted in U.S. federal and state regulations. This scenario is professionally challenging because the rapid evolution of technology and service delivery models can outpace explicit regulatory definitions, requiring providers to exercise careful judgment in interpreting existing guidelines. The core challenge lies in distinguishing between services that fall under the purview of telemental health, requiring specific licensure, consent, and security protocols, and those that might be considered general health information exchange or consultation. The correct approach represents best professional practice because it aligns with the TMH's emphasis on patient safety, privacy, and ethical service delivery as mandated by relevant U.S. federal laws like HIPAA and state-specific telehealth statutes. Providers must ensure that their services are clearly defined as telemental health if they involve the diagnosis, treatment, or management of mental health conditions remotely. This includes verifying that the technology used is secure, that informed consent specifically addresses telemental health risks and benefits, and that the provider is licensed in the patient's jurisdiction of residence. Adhering to these principles safeguards patient well-being and maintains professional integrity. An incorrect approach that defines telemental health solely by the technology used, without considering the nature of the mental health service being provided, fails to recognize the regulatory distinctions. This could lead to providing services without the necessary licensure in the patient's state, violating state practice acts, and potentially exposing the provider to legal and disciplinary action. Another incorrect approach that excludes remote consultations between mental health professionals from the scope of telemental health, even if they involve discussing patient care, overlooks the potential for sensitive information exchange and the need for appropriate security measures, which are often implicitly covered by broader telemental health guidelines aimed at protecting patient data. Furthermore, an approach that considers any remote interaction as telemental health, regardless of whether it involves direct patient care or diagnosis, broadens the definition beyond its intended regulatory scope and could lead to unnecessary administrative burdens and misinterpretations of licensure requirements. The professional decision-making process for similar situations should involve a thorough review of current TMH guidelines, relevant state telehealth laws in both the provider's and patient's jurisdictions, and federal regulations such as HIPAA. When in doubt, consulting with legal counsel specializing in healthcare law or professional regulatory bodies is advisable. A risk-benefit analysis, prioritizing patient safety and regulatory compliance, should guide the determination of whether a specific service falls within the scope of telemental health. Question 2. Risk assessment procedures indicate that a client receiving telemental health services has disclosed a specific plan and intent to end their life within the next 24 hours. The provider is unable to ascertain the client's precise location or the immediate availability of any support system due to the nature of the telemental health session. The provider has attempted to gather more information about the client's immediate environment and support network, but the client remains guarded. What is the most appropriate course of action for the telemental health provider to take to ensure client safety while adhering to professional and legal obligations? Option A. Rely solely on the client's verbal assurance that they will not act on their suicidal ideation and continue with the scheduled session. Documenting the disclosure. Option B. Immediately contact local emergency services in the client's presumed jurisdiction, providing them with all available information. After consulting with a supervisor or legal counsel regarding state-specific duty to warn/protect laws. Option C. Advise the client that due to the inability to verify their safety, the session must be terminated and no further action can be taken due to privacy regulations. Option D. Attempt to gather more information about the client's location and support system through persistent questioning, delaying any external intervention until absolute certainty of imminent danger is established. Correct answer is B. Immediately contact local emergency services in the client's presumed jurisdiction, providing them with all available information. After consulting with a supervisor or legal counsel regarding state-specific duty to warn/protect laws. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in telemental health, balancing the client's right to privacy with the provider's ethical and legal obligations to ensure safety. The client's disclosure of suicidal ideation, coupled with the provider's inability to confirm the client's location or immediate safety due to the telemental health modality, creates a critical juncture requiring immediate and careful decision-making. The professional challenge lies in navigating the inherent limitations of remote assessment and intervention, while adhering to stringent confidentiality and duty to warn/protect principles. Correct approach analysis. The correct approach prioritizes client safety while adhering to the ethical and legal mandates of telemental health practice. This involves a multi-step process. First, attempting to gather as much information as possible about the client's immediate environment and support system through direct questioning. If the risk remains imminent and unmitigated, the next crucial step is to consult with a supervisor or legal counsel to ensure compliance with relevant state laws regarding duty to warn/protect and involuntary commitment procedures. Simultaneously, initiating contact with local emergency services in the client's presumed jurisdiction, providing them with all available information, is paramount. This approach upholds the provider's duty to protect the client from harm, even when it necessitates a breach of confidentiality, which is ethically and legally permissible under such circumstances. The specific regulations governing telemental health in the U.S., such as those outlined by the Health Insurance Portability and Accountability Act, HIPAA, and state-specific licensing board regulations, permit such disclosures when there is an imminent threat of harm to self or others. Incorrect approaches analysis. One incorrect approach would be to solely rely on the client's assurance of safety without further verification or consultation, especially given the explicit suicidal ideation. This fails to acknowledge the potential for impaired judgment in individuals experiencing suicidal crises and neglects the provider's duty to protect. It represents a significant ethical and legal failure to adequately assess and respond to a life-threatening situation. Another incorrect approach would be to immediately contact emergency services without attempting to gather more information or consulting with a supervisor. While immediate action is crucial, a hasty, unconsulted response might lead to unnecessary intervention or misdirected resources if critical details about the client's situation or location are not adequately conveyed. This could also violate privacy unnecessarily if less intrusive measures were viable and overlooked. A third incorrect approach would be to terminate the session and cease all contact, citing privacy concerns or the inability to verify the situation. This is a dereliction of professional duty and a clear violation of ethical guidelines that mandate a response to imminent danger. It abandons the client in a critical moment and exposes the provider to significant legal and ethical repercussions. Professional reasoning. Professionals should employ a risk assessment framework that includes 1. Thorough assessment of the immediate risk of harm, utilizing all available telemental health tools and direct questioning. 2. Consultation with supervisors or legal counsel to ensure adherence to legal and ethical obligations, particularly regarding duty to warn/protect and state-specific reporting requirements. 3. Documentation of all assessments, interventions, and consultations. 4. If imminent risk persists and cannot be mitigated through less intrusive means, appropriate action to protect the client, which may include contacting emergency services in the client's jurisdiction is taken. This systematic approach ensures that client safety is paramount while navigating the complexities of telemental health practice and its associated legal and ethical responsibilities. Question 3. During the evaluation of a client via telemental health, a board-certified telemental health provider, BCTMH, is considering how to administer a standardized personality inventory that was originally designed for in-person administration. The provider recognizes that the remote setting may introduce unique challenges to the assessment process. Which of the following approaches best reflects adherence to BCTMH standards for adapting traditional assessment tools for remote use? Option A. Select a different, less established assessment tool that is readily available online and appears to be suitable for remote use without verifying its psychometric validation for telemental health. Option B. Administer the traditional personality inventory exactly as it is written, assuming that the client's responses will be equivalent to an in-person administration, and proceed with interpretation. Option C. Systematically review the psychometric properties of the original tool, identify potential impacts of the remote modality on each assessment component, and implement appropriate modifications or alternative strategies to maintain validity and reliability, while ensuring client comprehension and engagement. Option D. Rely exclusively on the client's self-report of their personality traits during the telehealth session, without using any structured or adapted assessment tools. Correct answer is C. Systematically review the psychometric properties of the original tool, identify potential impacts of the remote modality on each assessment component, and implement appropriate modifications or alternative strategies to maintain validity and reliability, while ensuring client comprehension and engagement. Explanation. This scenario presents a professional challenge because adapting traditional assessment tools for remote use requires a careful balance between maintaining the psychometric integrity of the assessment and ensuring client safety and engagement in a telehealth environment. The BCTMH provider must consider how the absence of in-person cues, potential technological barriers, and the unique dynamics of a remote interaction might impact the validity and reliability of the assessment results. Careful judgment is required to select and implement adaptations that are both clinically sound and ethically responsible, adhering to the standards of telemental health practice. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for adapting assessment tools. This involves a thorough review of the original tool's psychometric properties, careful consideration of how each item or section might be affected by the remote modality, and the implementation of appropriate modifications or alternative strategies. This approach aligns with the ethical principles of competence and due diligence, ensuring that the assessment remains valid and reliable for diagnostic and treatment planning purposes. Furthermore, it demonstrates a commitment to client welfare by seeking to minimize potential biases or inaccuracies introduced by the telehealth setting. Adherence to the BCTMH Code of Ethics, which emphasizes the importance of using appropriate assessment methods in telemental health, is paramount. An incorrect approach that involves simply administering the traditional tool verbatim without any modifications fails to acknowledge the inherent differences between in-person and remote assessment. This can lead to inaccurate results due to the lack of nonverbal cues, potential for environmental distraction, and the absence of direct observation of the client's behavior during administration. This approach could violate the BCTMH standard of care by not ensuring the assessment is administered in a manner that yields valid and reliable data. Another incorrect approach, such as relying solely on client self-report without any attempt to validate or supplement the information through adapted methods, risks overlooking critical information or misinterpreting client responses. While self-report is a component of assessment, over-reliance on it in a remote setting, without considering how the modality might influence reporting, can compromise the comprehensiveness and accuracy of the evaluation. This could be seen as a failure to exercise due diligence in assessment, potentially leading to misdiagnosis or inappropriate treatment planning, which contravenes ethical guidelines for competent practice. A further incorrect approach, such as using an assessment tool that has not been validated for remote administration or adaptation, introduces significant risk. Without evidence of its suitability for telehealth, the provider cannot be assured of the tool's psychometric properties in this context. This could lead to unreliable or invalid findings, potentially harming the client through misdiagnosis or ineffective treatment. This directly violates the BCTMH requirement to use assessment methods that are appropriate and validated for the telemental health context. The professional decision-making process for similar situations should involve a systematic evaluation of the assessment needs, the specific telemental health context, and the available tools. This includes researching evidence-based guidelines for adapting assessment tools for telehealth, consulting with colleagues or supervisors if necessary, and critically evaluating the potential impact of remote delivery on each component of the assessment. The provider should prioritize client safety, confidentiality, and the integrity of the assessment process throughout. Question 4. The evaluation methodology shows that a telemental health provider is conducting a session with a client who expresses feelings of hopelessness and states, "I can't take this anymore, and I don't see a point in living." The provider needs to determine the most appropriate course of action to ensure the client's safety while adhering to professional standards. Which of the following approaches best reflects best practice in this telemental health crisis scenario? Option A. Directly ask the client about their intent and plan to harm themselves. Collaboratively develop a safety plan and clearly outline the next steps for the client, including how to access further support. Option B. Advise the client to contact their primary care physician for assistance and then end the session, as the provider's scope of practice may not cover acute crisis intervention. Option C. Reassure the client that things will get better and encourage them to focus on positive aspects of their life, then schedule a follow-up appointment for the next day. Option D. Immediately terminate the session and contact emergency services to initiate a welfare check, as the client's statement indicates an imminent risk. Correct answer is D. Immediately terminate the session and contact emergency services to initiate a welfare check, as the client's statement indicates an imminent risk. Explanation. This scenario presents a professional challenge due to the inherent complexities of assessing and intervening in a crisis via telemental health, where direct physical observation is absent. The provider must balance the client's autonomy with the ethical and legal imperative to ensure safety, all within the limitations of the telemental health modality. The urgency of a crisis requires swift, yet measured, decision-making. The correct approach represents best professional practice because it prioritizes a systematic, multifaceted risk assessment that directly addresses the immediate safety concerns while respecting the client's expressed wishes as much as possible. This aligns with the ethical principles of beneficence and non-maleficence, as well as the legal duty of care. Specifically, it involves a direct, clear inquiry into suicidal ideation, intent, and plan, which is a cornerstone of crisis assessment in telemental health. The subsequent steps of developing a safety plan collaboratively, involving emergency contacts, and clearly outlining the next steps for the client are crucial for mitigating immediate risk and ensuring continuity of care. This approach is consistent with best practices in telemental health, which emphasize clear communication, robust safety planning, and adherence to established crisis protocols, often informed by state-specific mental health laws and professional ethical codes that guide telemental health practice. An incorrect approach that involves immediately terminating the session and contacting emergency services without a thorough assessment of the immediate risk and the client's capacity to engage in safety planning would be a regulatory and ethical failure. This bypasses the opportunity to de-escalate the crisis, potentially alienating the client and undermining the therapeutic alliance. Could also be seen as an overreach if the assessment did not definitively establish an imminent risk to life. Another incorrect approach, such as relying solely on the client's verbal assurances of safety without further probing or developing a concrete safety plan, would fail to meet the standard of care and could violate ethical obligations to protect the client from harm. This approach neglects the provider's responsibility to actively assess and manage risk, particularly when a client is in crisis. A third incorrect approach, which involves delaying intervention to consult with a supervisor without first taking immediate steps to ensure the client's safety, would be a critical failure in a time-sensitive crisis situation, potentially leading to adverse outcomes. While consultation is valuable, the immediate priority in a crisis is to address the imminent threat. Professionals should employ a decision-making framework that begins with a rapid, yet comprehensive risk assessment. This involves active listening, direct questioning about suicidal ideation, intent, and plan, and assessing the client's protective factors and coping mechanisms. Following the assessment, the provider should collaboratively develop a safety plan, which may include identifying triggers, coping strategies, and support networks. If the risk remains high and the client is unable to engage in safety planning, the provider must then consider escalating interventions, such as contacting emergency services or designated crisis responders, while maintaining clear communication with the client about these actions whenever possible. The decision to involve external resources should be guided by the assessed level of risk and the client's capacity to ensure their own safety. Question 5. The efficiency study reveals that a TMH provider's current method of monitoring client progress remotely, which involves asking clients to email subjective updates and reflections between sessions, is time-consuming and lacks objective data points. The provider is exploring alternative strategies to enhance the efficiency and effectiveness of progress evaluation while maintaining strict adherence to telemental health regulation. Which of the following strategies best balances efficiency, effectiveness, and regulatory compliance for monitoring client progress remotely? Option A. Relying exclusively on the provider's subjective interpretation of client verbal reports during live telemental health sessions, without any supplementary objective or client-reported data. Option B. Initiating automated daily text message check-ins with clients to gather brief status updates, without first obtaining specific consent for this method or verifying the security of the text messaging platform. Option C. Transitioning to using standard unencrypted email for clients to send their progress updates and reflections, as this is a widely accessible and familiar communication method. Option D. Implementing a secure, HIPAA-compliant platform for clients to complete standardized, validated client-reported outcome measures, PROM, at regular intervals, with the provider reviewing these reports prior to sessions and discussing any significant changes with the client. The correct answer is D. Implementing a secure, HIPAA-compliant platform for clients to complete standardized, validated client-reported outcome measures, PROM, at regular intervals, with the provider reviewing these reports prior to sessions and discussing any significant changes with the client. Explanation. This scenario presents a professional challenge because the TMH provider must balance the need for efficient client progress monitoring with the ethical and regulatory imperative to ensure client privacy and data security, especially when utilizing technology for remote assessment. The core tension lies in selecting monitoring methods that are both effective in tracking therapeutic outcomes and compliant with the stringent privacy standards governing telemental health services. The correct approach represents best professional practice because it prioritizes client autonomy and informed consent while leveraging technology in a secure and compliant manner. Specifically, utilizing secure, HIPAA-compliant platforms for client-reported outcome measures, PROM, directly addresses the need for objective progress data without compromising confidentiality. This aligns with the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as regulatory requirements for data protection. The provider's proactive engagement with the client to explain the process and obtain consent ensures transparency and respects the client's right to privacy. An incorrect approach that involves using unencrypted email for progress updates fails to meet the fundamental security requirements for protected health information. 5. This violates HIPAA regulations, which mandate the use of secure communication channels for transmitting sensitive client data. Another incorrect approach, relying solely on subjective client self-reports during live sessions without any standardized or objective measures, may lead to an incomplete or biased understanding of progress, potentially hindering effective treatment planning and failing to meet the standard of care for thorough progress evaluation. A third incorrect approach, implementing automated client check-ins via text message without explicit consent for this specific method and without ensuring the platform's security, poses significant privacy risks and could be seen as a breach of trust and a violation of data protection laws. The professional decision-making process for similar situations should involve a thorough risk-benefit analysis of any proposed monitoring method. This includes assessing its effectiveness in gathering relevant progress data, its adherence to all applicable privacy and security regulations, e.g., HIPAA in the U.S., and its potential impact on the client's comfort and trust. Obtaining informed consent for all data collection methods is paramount. Providers should continuously evaluate their telemental health practices to ensure they remain current with technological advancements and regulatory changes, always prioritizing client well-being and data integrity. Question 6. Regulatory review indicates that telemental health providers must implement robust technical safeguards to protect electronic protected health information (EFI). When selecting a video conferencing platform for client sessions, which of the following approaches best aligns with these requirements and demonstrates a commitment to client privacy and data security? Option A. Employing a widely used, free consumer-grade video conferencing application that offers basic end-to-end encryption. Option B. Prioritizing a platform that is the most cost-effective and user-friendly, assuming that most clients will not have technical issues. Option C. Selecting a platform that provides some encryption features but has not undergone formal HIPAA compliance verification or offers a BAA. Option D. Utilizing a platform that has a business associate agreement (BA) in place with a reputable vendor and explicitly states its compliance with HIPAA security rule technical safeguards. Correct answer is D. Utilizing a platform that has a business associate agreement (BA) in place with a reputable vendor and explicitly states its compliance with HIPAA security rule technical safeguards. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a telemental health provider to balance the imperative of client privacy and data security with the practical need for reliable and accessible communication platforms. The rapid evolution of technology means that what is considered secure today may not be tomorrow, necessitating ongoing vigilance and adaptation. The provider must make informed decisions about technology adoption that align with both legal mandates and ethical obligations to protect vulnerable client information. Correct approach analysis. The correct approach represents best professional practice because it prioritizes adherence to the Health Insurance Portability and Accountability Act, HIPAA security rule, which mandates specific technical safeguards for electronic protected health information, EFI. This includes implementing access controls, audit controls, integrity controls, and transmission security. By selecting a platform that has undergone a business associate agreement (BA) with a reputable vendor, the provider ensures that the vendor is also contractually obligated to protect EPHI, thereby sharing responsibility for compliance. This proactive measure demonstrates a commitment to safeguarding client data and maintaining the confidentiality and integrity of telemental health services, which is a core ethical and legal requirement. Incorrect approaches analysis. An incorrect approach that relies solely on readily available consumer-grade video conferencing software without verifying its HIPAA compliance or establishing a BAA is a significant regulatory and ethical failure. Such software often lacks the necessary encryption, audit trails, and data handling protocols required to protect EPHI, exposing client information to potential breaches. This violates the HIPAA security rules requirements for technical safeguards and the principle of client confidentiality. Another incorrect approach, using a platform that offers some encryption but has not been vetted for HIPAA compliance or does not offer a BAA, also presents a regulatory and ethical risk. While encryption is a component of transmission security, it is not sufficient on its own. The platform must meet all the technical safeguards outlined in the HIPAA security rule, and the lack of a BAA means the provider cannot ensure the vendor's compliance with HIPAA, leaving the provider solely liable for any breaches originating from the vendor's services. Finally, an approach that prioritizes cost savings or ease of use over security and compliance is fundamentally flawed. Telemental health practice inherently involves handling sensitive personal information. Any decision that compromises the security of this information for financial or convenience reasons directly contravenes the ethical duty to protect clients and the legal obligations under HIPAA. This demonstrates a lack of professional judgment and a disregard for client welfare. Professional reasoning. Professionals should approach technology selection for telemental health by first identifying their legal and ethical obligations, particularly regarding data privacy and security. This involves understanding relevant regulations like HIPAA. The next step is to research and evaluate available platforms, looking for explicit statements of HIPAA compliance and the willingness of vendors to enter into a business associate agreement. Thorough assessment of the platform's technical safeguards, including encryption, access controls, and audit capabilities, is crucial. When faced with multiple options, the decision-making process should weigh the platform's ability to meet these requirements against its usability and cost, always prioritizing compliance and client protection. If a platform cannot definitively meet the necessary security standards and a BAA cannot be secured, it should be rejected, regardless of other perceived benefits. Question 7. System analysis indicates that a telemental health practice is considering integrating a new electronic health record (EHR) system with its existing telemental health platform. The primary goal is to streamline patient record management and improve workflow efficiency. However, the practice must ensure that this integration adheres strictly to all applicable federal and state regulations governing telehealth and patient privacy. Which of the following approaches best ensures compliance and protects patient data? Option A. Prioritize the EHR vendor that offers the most competitive pricing and the quickest integration timeline, assuming their general marketing materials indicate HIPAA compliance. Option B. Integrate the EHR system without a detailed review of the vendor's data security protocols, as long as the platform itself is designed for telemental health use. Option C. Proceed with integration using the EHR system that is most familiar to the practice's administrative staff, relying on their existing knowledge of data handling procedures. Option D. Conduct a thorough due diligence process on potential EHR vendors, specifically verifying their adherence to HIPAA security rule requirements, state telehealth laws, and ensuring a robust business associate agreement (BA) is in place before integration. Correct answer is A. Prioritize the EHR vendor that offers the most competitive pricing and the quickest integration timeline, assuming their general marketing materials indicate HIPAA compliance. Explanation. Scenario analysis. This scenario presents a common implementation challenge in telemental health, integrating electronic health records (EHR) with telemental health platforms while ensuring patient privacy and data security. The challenge lies in balancing the efficiency gains of integrated systems with the stringent requirements of HIPAA, Health Insurance Portability and Accountability Act, and state-specific telehealth regulations. Professionals must navigate technical complexities, vendor agreements, and the ethical imperative to protect sensitive patient information. The rapid evolution of technology and varying levels of vendor compliance further complicate this landscape, demanding a proactive and informed approach to risk management. Correct approach analysis. The correct approach prioritizes a thorough vendor assessment that explicitly verifies compliance with HIPAA security rule and relevant state telehealth laws. This involves reviewing vendor policies, data encryption protocols, access controls, and business associate agreements (BA). It ensures that the chosen EHR/telehealth integration solution meets the legal and ethical standards for protecting protected health information. 5. This due diligence is crucial for establishing a secure and compliant telemental health practice, mitigating the risk of data breaches and regulatory penalties, and upholding patient trust. Incorrect approaches analysis. One incorrect approach involves prioritizing cost savings and ease of integration over a comprehensive compliance review. This overlooks the critical need to ensure that the vendor's security measures and data handling practices align with HIPAA and state telehealth laws. Failure to do so creates significant vulnerabilities for PHI, potentially leading to breaches, identity theft, and severe legal repercussions, including substantial fines and reputational damage. Another incorrect approach is to assume that a vendor's general HIPAA-compliant marketing claim is sufficient without independent verification. This passive acceptance of vendor assurances is a dangerous oversight. It fails to acknowledge that compliance is an ongoing process and that specific implementation details matter. Without a detailed review of the vendor's actual practices and contractual obligations (BA), the practice remains exposed to risks. A third incorrect approach is to proceed with integration without a clear understanding of data flow and access controls within the integrated system. This lack of technical and procedural clarity can lead to unauthorized access to PHI, accidental disclosures, and difficulties in auditing data access. It demonstrates a failure to implement robust internal controls necessary for maintaining patient privacy and security in a telemental health setting. Professional reasoning. Professionals should adopt a systematic risk management framework. This begins with identifying all potential threats to patient privacy and data security in the telemental health context. Next, they should evaluate the likelihood and impact of these threats. The chosen EHR/telehealth integration solution must then be assessed against established legal and ethical standards, with a strong emphasis on vendor due diligence and contractual safeguards. Regular audits, ongoing training for staff, and a clear incident response plan are essential components of maintaining a secure and compliant telemental health practice. Question 8. The audit findings indicate that a board-certified telemental health provider, TMH, has been providing services to clients residing in multiple states, but only holds an active license in their home state. The audit has raised concerns about the provider's compliance with interstate licensure requirements for telemental health practice. Which of the following actions best addresses these audit findings and ensures regulatory compliance? Option A. Continue providing services to all clients, assuming that the TMH certification provides a blanket authorization for interstate telemental health practice. Option B. Consult with a legal professional to determine if the TMH certification can be leveraged to obtain a waiver for state-specific licensure requirements. Option C. Rely on the assumption that if no client complaints have been filed, then no regulatory issues exist regarding interstate licensure. Option D. Immediately cease providing services to clients in any state other than the one in which the provider is licensed, until appropriate licensure or registration is obtained in those states. The correct answer is D. Immediately cease providing services to clients in any state other than the one in which the provider is licensed, until appropriate licensure or registration is obtained in those states. Explanation. This scenario presents a professional challenge due to the inherent complexity of navigating interstate licensure requirements in telemental health, particularly when a provider operates across state lines without fully understanding the implications for their practice. The audit findings highlight a potential compliance gap, necessitating a careful assessment of the provider's actions against the regulatory framework governing telemental health practice. The correct approach represents best professional practice because it prioritizes adherence to the specific licensure laws of the states where clients are located. The board-certified telemental health provider, TMH, credential signifies a commitment to ethical and legal practice, which includes understanding and complying with the jurisdictional requirements for providing services. The primary regulatory and ethical imperative in telemental health is to ensure that services are delivered within a legally recognized framework, protecting both the client and the provider. This involves obtaining licensure in each state where a client resides and receives services, as dictated by state licensing boards. This proactive and compliant approach mitigates legal risks, upholds professional standards, and ensures client safety by guaranteeing that the provider is subject to the oversight of the relevant licensing bodies. An incorrect approach that involves assuming a single state license is sufficient for all telemental health clients, regardless of their location, represents a significant regulatory and ethical failure. This demonstrates a lack of understanding of interstate practice laws, which are designed to protect the public by ensuring that practitioners are licensed and accountable in the jurisdictions where services are rendered. Such an assumption could lead to practicing without a license in certain states, which carries severe penalties including fines, disciplinary actions by licensing boards, and potential legal liability. Another incorrect approach, such as relying solely on the TMH certification as a substitute for state licensure, is also a regulatory failure. While the TMH certification indicates advanced knowledge and skills in telemental health, it does not confer licensure or grant the authority to practice across state lines. State licensure is a legal requirement, whereas certification is a professional credential. Finally, an approach that involves delaying licensure in a new state until a formal complaint is filed is a reactive and irresponsible strategy that exposes both the provider and their clients to undue risk. It demonstrates a disregard for proactive compliance and the ethical obligation to practice within legal boundaries. The professional decision-making process for similar situations should begin with a thorough understanding of the telemental health practice laws in all states where clients are located. This involves consulting state licensing board websites, professional association guidelines, and legal counsel specializing in healthcare law. A risk assessment should be conducted to identify potential compliance gaps. The provider should then prioritize obtaining the necessary licenses or registrations before initiating services in a new jurisdiction. Regular review of evolving telemental health regulations and maintaining a system for tracking licensure status across all practice states are crucial for ongoing compliance. Question 9. Implementation of telecommunication technologies for telemental health services requires careful consideration of various platforms. A board-certified telemental health provider, TMH, is evaluating options for secure video conferencing and asynchronous communication. Which of the following approaches best aligns with regulatory requirements and ethical best practices for protecting client privacy and data security in the United States? Option A. Selecting platforms that offer end-to-end encryption, have a demonstrated commitment to healthcare data security, and for which a business associate agreement (BA) can be obtained, ensuring compliance with HIPAA. Option B. Opting for platforms that primarily focus on user-friendliness and affordability, assuming that general internet security measures are sufficient to protect sensitive mental health information. Option C. Utilizing readily available, free consumer-grade video conferencing applications that are widely used and perceived as convenient for both provider and client, without specific verification of their healthcare compliance. Option D. Employing a mix of personal and professional communication channels, including standard email and social media messaging, for client interactions to maximize accessibility, without explicit client consent for these less secure methods. The correct answer is A. Selecting platforms that offer end-to-end encryption, have a demonstrated commitment to healthcare data security, and for which a business associate agreement (BA) can be obtained, ensuring compliance with HIPAA. Explanation. The scenario presents a common challenge in telemental health, selecting appropriate technology while ensuring client privacy and adherence to regulatory standards. The professional must balance the benefits of various telecommunication platforms with the legal and ethical obligations to protect sensitive health information. This requires a nuanced understanding of how different technologies function and their implications for data security and client confidentiality. The correct approach prioritizes platforms that offer robust end-to-end encryption and are specifically designed or validated for healthcare use, aligning with the Health Insurance Portability and Accountability Act, HIPAA, in the U.S. This ensures that protected health information, FI, is transmitted and stored securely, minimizing the risk of breaches. Adherence to HIPAA security rule, which mandates administrative, physical, and technical safeguards, is paramount. Furthermore, obtaining business associate agreements (BA) with platform providers is a critical step in ensuring compliance and shared responsibility for data protection. This approach reflects best professional practice by proactively mitigating risks and demonstrating a commitment to client safety and privacy, which are foundational ethical principles in mental health care. An incorrect approach would be to select a platform based solely on ease of use or cost without verifying its security features or HIPAA compliance. For instance, using a standard consumer-grade video conferencing tool that lacks end-to-end encryption or does not offer a BAA would be a significant regulatory and ethical failure. This exposes client PHI to potential unauthorized access, violating HIPAA privacy and security rules. Another incorrect approach would be to assume that any platform labeled secure is automatically compliant. Professionals must actively investigate the specific security protocols, data handling practices, and compliance certifications of any telecommunication technology before using it for client services. Failure to do so constitutes negligence and a breach of professional duty, potentially leading to severe legal and disciplinary consequences. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes identifying the type of data being transmitted, the potential vulnerabilities of different technologies, and the specific regulatory requirements applicable to the practice. Professionals should consult their licensing board's guidelines, relevant federal and state laws, like HIPAA in the U.S., and ethical codes. When in doubt, seeking consultation with legal counsel or a telemental health technology expert is advisable. A proactive and informed approach to technology selection is essential for maintaining client trust and ensuring ethical and legal practice. Question 10. Process analysis reveals that a board-certified telemental health provider, TMH, is preparing for an initial assessment with a new client via a secure video conferencing platform. The client has indicated a willingness to engage in telemental health services. Which of the following actions best ensures compliance with TMH standards for conducting assessments via telemental health? Option A. The provider assumes that because the client agreed to schedule a telemental health appointment, they fully understand and consent to all aspects of the service. Option B. The provider briefly mentions that the session is being conducted via telemental health and that confidentiality will be maintained, then proceeds with the assessment after the client verbally agrees to the appointment. Option C. The provider sends a comprehensive informed consent document via email for the client to review and electronically sign prior to the scheduled assessment, assuming the client will understand its contents. Option D. The provider engages in a detailed, interactive discussion with the client about the nature of telemental health services, including confidentiality, security measures, potential risks and benefits, the client's right to withdraw, and confirms the client's understanding and voluntary agreement before proceeding with the assessment. The correct answer is D. The provider engages in a detailed, interactive discussion with the client about the nature of telemental health services, including confidentiality, security measures, potential risks and benefits, the client's right to withdraw, and confirms the client's understanding and voluntary agreement before proceeding with the assessment. Explanation. This scenario presents a professional challenge because the telemental health provider must balance the ethical imperative of obtaining informed consent with the practical realities of conducting an initial assessment remotely. The core difficulty lies in ensuring the client fully understands the nature, risks, and benefits of telemental health services, especially when they may be experiencing distress or have limited technological literacy. Careful judgment is required to adapt standard consent procedures to the telemental health modality without compromising the client's autonomy or the provider's professional responsibility. The correct approach represents best professional practice because it prioritizes a comprehensive and interactive informed consent process tailored to the telemental health context. This involves not only providing information about the service, but actively engaging the client in a dialogue to confirm understanding and address any concerns. This aligns with the ethical principles of autonomy and beneficence, ensuring the client can make a voluntary and informed decision about their care. Specifically, it adheres to the TMH ethical guidelines, which emphasize clear communication regarding confidentiality limitations in telemental health, the client's right to withdraw, and the technical requirements for effective service delivery. An incorrect approach that involves simply sending a consent form electronically for the client to sign without further discussion fails to adequately ensure comprehension. This is a regulatory and ethical failure because it bypasses the provider's responsibility to actively verify the client's understanding, particularly concerning the unique aspects of telemental health such as data security and potential technological disruptions. Another incorrect approach, which is to proceed with the assessment after a brief verbal mention of consent without confirming understanding, also falls short. This neglects the requirement for a robust informed consent process that goes beyond mere notification to active confirmation of comprehension, risking a violation of client autonomy and potentially leading to misunderstandings about the service. A third incorrect approach, which is to assume the client's understanding based on their agreement to schedule the appointment, is a significant ethical lapse. This presumption ignores the critical need for explicit and documented informed consent regarding the specific modality of service delivery, thereby failing to uphold the client's right to make an informed choice. A professional decision-making process for similar situations should involve a systematic approach. First, identify the specific ethical and regulatory requirements for informed consent in telemental health as outlined by the TMH framework. Second, assess the client's potential vulnerabilities and technological proficiency to tailor the consent process accordingly. Third, engage in an interactive dialogue using clear and accessible language to explain all relevant aspects of telemental health services, including confidentiality, security, limitations, and the client's rights. Fourth, actively solicit questions and confirm the client's understanding before proceeding with the assessment. Finally, document the informed consent process thoroughly, including the methods used to ensure comprehension. Question 11. Market research demonstrates that a significant portion of the potential client base for telemental health services experiences barriers related to technology access, digital literacy, and cultural communication preferences. As a board-certified telemental health provider, TMH, what is the most effective and ethically sound approach to optimize service accessibility for these diverse populations? Option A. Focus solely on providing high-quality clinical content, with the expectation that clients who are unable to access the service will seek alternative, more accessible providers. Option B. Utilize the most common and widely available telemental health platform, assuming its standard features will be sufficient for the majority of clients. Option C. Assume that clients will communicate any specific accessibility needs they have during the initial intake process and address them on a case-by-case basis as they arise. Option D. Develop a comprehensive accessibility plan that includes offering multiple communication modalities, providing clear technical support, ensuring platform compatibility with assistive technologies, and incorporating culturally responsive communication strategies into service delivery. The correct answer is D. Develop a comprehensive accessibility plan that includes offering multiple communication modalities, providing clear technical support, ensuring platform compatibility with assistive technologies, and incorporating culturally responsive communication strategies into service delivery. Explanation. Scenario analysis. This scenario presents a professional challenge because telemental health providers must proactively address the diverse accessibility needs of their client base to ensure equitable access to care. Failing to do so not only creates barriers to treatment, but also violates ethical principles of non-discrimination and professional responsibility. The complexity lies in identifying and implementing practical, compliant solutions that cater to a wide spectrum of needs, from technological literacy to physical limitations and cultural considerations, all within the scope of TMH standards. Correct approach analysis. The correct approach involves a multifaceted strategy that integrates accessibility features directly into the service delivery model. This includes offering multiple communication modalities, e.g., video, phone, secure messaging, providing clear, user-friendly instructions for technology use, ensuring platform compatibility with assistive technologies, and offering culturally responsive communication options. This approach aligns with the ethical imperative to provide services in a manner that is accessible and effective for all individuals, regardless of their background or abilities. It also reflects a commitment to process optimization by embedding accessibility into the core operational framework, rather than treating it as an afterthought. This proactive stance minimizes barriers and maximizes the potential for positive client outcomes, adhering to the spirit and letter of professional guidelines that emphasize client welfare and equitable access. Incorrect approaches analysis. One incorrect approach is to assume that standard telemental health platforms are inherently accessible to all clients. This overlooks the reality that many individuals may face technological barriers, lack digital literacy, or have specific needs that are not met by default settings. This failure to assess and accommodate individual needs can lead to exclusion and a denial of services, which is ethically problematic and potentially non-compliant with accessibility mandates. Another incorrect approach is to rely solely on client self-advocacy for accessibility needs. While clients should be empowered to express their needs, placing the entire burden on them is insufficient and can disadvantage those who are less comfortable or able to articulate their requirements. Professional responsibility dictates that providers take initiative in identifying and addressing potential barriers. A third incorrect approach is to implement accessibility features only upon specific request, without a broader strategy. This reactive rather than proactive stance can result in delays in care and may still leave many clients underserved. It suggests a lack of commitment to systemic accessibility and process optimization, treating accessibility as an add-on rather than an integral component of service delivery. Professional reasoning. Professionals should adopt a client-centered and proactive approach to accessibility. This involves conducting a thorough needs assessment, which may include pre-session questionnaires or direct inquiries about technological comfort, preferred communication methods, and any specific accessibility requirements. Providers should familiarize themselves with the capabilities and limitations of their chosen telemental health platforms regarding accessibility features. They should also stay informed about relevant ethical guidelines and best practices for serving diverse populations. When faced with a situation requiring accessibility accommodations, professionals should consult relevant ethical codes and regulatory guidance to ensure their actions are both effective and compliant. Continuous professional development in cultural competence and accessibility is crucial for providing high-quality, equitable telemental health services. Question 12. Process analysis reveals that a telemental health provider is preparing to conduct an initial assessment with a new client who reports experiencing symptoms suggestive of depression. The client indicates they are currently residing in a state where the provider is not licensed. The provider has access to several screening tools, including one that is widely used but not specifically validated for the client's reported demographic, another that is validated for a similar demographic but in a different geographic region, and a third that is validated for the client's specific demographic and cultural background, but requires the provider to be licensed in the client's state of residence. Which of the following actions represents the most appropriate and ethically sound approach for the telemental health provider in this situation? Option A. Utilize the screening tool validated for a similar demographic in a different geographic region, explaining to the client that while not perfect, it offers a reasonable approximation for initial screening. Option B. Inform the client that the provider cannot proceed with services due to lack of licensure in their state, and provide a referral to a qualified telemental health professional licensed in the client's jurisdiction. Option C. Proceed with the assessment using the screening tool validated for the client's specific demographic and cultural background, while simultaneously initiating the process to obtain licensure in the client's state of residence. Option D. Administer the widely used screening tool, as it is generally accepted and can provide a baseline understanding of the client's symptoms and inform the client about the limitations. The correct answer is C. Proceed with the assessment using the screening tool validated for the client's specific demographic and cultural background, while simultaneously initiating the process to obtain licensure in the client's state of residence. Explanation. Scenario analysis. This scenario presents a common challenge in telemental health practice, selecting appropriate screening tools for diverse client populations across state lines. The professional must balance the efficacy of the tool with the legal and ethical implications of its application, particularly when the client's location is not immediately clear or may change. The inherent limitations of remote assessment and the need for culturally sensitive and validated instruments add layers of complexity. Correct approach analysis. The correct approach prioritizes client safety and adherence to regulatory frameworks by ensuring the chosen screening tool is validated for the client's specific demographic and geographic context, and that the provider is licensed in the client's jurisdiction. This aligns with the TMH ethical guidelines and state licensing board regulations, which mandate that providers practice within their scope of competence and geographic licensure. Utilizing a tool validated for the client's cultural background and presenting concerns and confirming licensure in the client's state of residence are paramount for ethical and legal telemental health service delivery. Incorrect approaches analysis. Selecting a widely used screening tool without verifying its validation for the client's specific cultural background or geographic location is a regulatory and ethical failure. This can lead to misdiagnosis, inappropriate treatment, and a violation of the principle of competence. Administering a screening tool without confirming the provider's licensure in the client's state of residence is a direct violation of state licensing laws and telemental health regulations. This constitutes practicing without a license, which carries severe legal and professional consequences. Relying solely on a client's self-report of symptoms without using a standardized, validated screening tool can lead to subjective assessments and potentially overlook critical diagnostic information, failing to meet the standard of care for mental health screening. Using a screening tool validated for a different cultural or linguistic group without appropriate adaptation or translation is an ethical breach, as it can lead to misinterpretation of symptoms and inaccurate assessments, compromising client care. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with identifying the client's location and understanding the relevant jurisdictional laws and regulations. This is followed by an assessment of the client's presenting concerns and demographic characteristics to determine the most appropriate and validated screening tools. Crucially, before initiating services, the provider must verify their licensure in the client's state of residence. If licensure is not present, the provider must refer the client to a qualified professional in their jurisdiction. Ongoing professional development in telemental health best practices and cultural competency is essential to navigate these complex scenarios effectively. Question 13. Investigation of a client presenting with symptoms suggestive of a mood disorder via telemental health reveals a discrepancy between the client's verbal report of significant distress and their observable effect, which appears relatively flat during the video session. The client also reports social withdrawal, but is unable to provide specific examples of how this impacts their daily functioning due to their perceived difficulty in recalling details. The telemental health provider is concerned about the accuracy of the diagnosis given the limited nonverbal cues and the client's reported memory difficulties. What is the most appropriate next step for the provider to ensure an accurate and ethical diagnosis? Option A. Actively seek consent to gather collateral information from a trusted family member or friend, to corroborate the client's self-report and observe their functioning in a different context, while also employing a variety of telemental health assessment techniques to build rapport and gather further information. Option B. Proceed with a provisional diagnosis based on the client's self-report alone, acknowledging the limitations of the virtual setting in the treatment plan. Option C. Delay any diagnostic formulation indefinitely until in-person sessions can be scheduled, as accurate diagnosis is not possible via telemental health. Option D. Rely primarily on standardized telemental health questionnaires to gather objective data, minimizing direct interaction to avoid potential misinterpretation of effect. The correct answer is A. Actively seek consent to gather collateral information from a trusted family member or friend, to corroborate the client's self-report and observe their functioning in a different context, while also employing a variety of telemental health assessment techniques to build rapport and gather further information. Explanation. Scenario analysis. This scenario presents a common challenge in telemental health: the potential for misinterpretation of nonverbal cues and the difficulty in establishing rapport and trust solely through a virtual medium. The provider must navigate the diagnostic process while acknowledging the limitations of the telemental health modality, ensuring that the assessment is comprehensive and ethically sound. Adhering to the standards of practice for telemental health, as defined by relevant professional bodies and regulatory frameworks governing telemental health practice in the United States. Correct approach analysis. The correct approach prioritizes a thorough, multifaceted assessment that acknowledges the limitations of the virtual setting. This involves actively seeking additional information to compensate for the lack of in-person observation. Specifically, obtaining collateral information from a trusted family member or friend, if ethically permissible and with client consent, can provide valuable context and corroborate the client's self-report. Furthermore, employing a variety of assessment techniques, including open-ended questions, active listening, and structured diagnostic interviews tailored for telemental health, helps to build rapport and gather richer data. This approach aligns with ethical guidelines that mandate competent practice, which includes understanding and mitigating the risks associated with the chosen modality. It also reflects the principle of beneficence by ensuring the client receives an accurate diagnosis and appropriate treatment plan, minimizing the risk of misdiagnosis due to the virtual format. Adherence to the TMH standards requires a commitment to client welfare, which necessitates a more cautious and comprehensive approach when diagnostic certainty is challenged by the telemental health environment. Incorrect approaches analysis. One incorrect approach involves proceeding with a definitive diagnosis based solely on the client's self-report and limited virtual observation. This fails to acknowledge the inherent limitations of telemental health in capturing the full spectrum of a client's presentation, including subtle nonverbal cues and behavioral patterns observable in person. This approach risks misdiagnosis and can lead to inappropriate treatment, violating the ethical principle of non-maleficence. It also falls short of the competency standards for telemental health, which require providers to be aware of and address the unique challenges of the modality. Another incorrect approach is to delay diagnosis indefinitely due to the perceived limitations of the virtual setting, without actively seeking to overcome these limitations. While caution is warranted, an indefinite delay can be detrimental to the client's well-being, preventing them from receiving necessary treatment. Ethical practice demands that providers make reasonable efforts to gather sufficient information for diagnosis and treatment planning, utilizing available resources and adapting their methods to the telemental health context. A third incorrect approach involves relying heavily on standardized questionnaires without integrating them into a broader clinical assessment that includes direct interaction and collateral information. While standardized tools are valuable, they are often insufficient on their own for a comprehensive diagnosis, especially in a virtual setting where the provider has less direct observational data. Over-reliance on such tools without clinical integration can lead to a decontextualized understanding of the client's presentation and potential misinterpretations of the results. Professional reasoning. When faced with diagnostic uncertainty in a telemental health setting, a professional decision-making process should involve 1. Recognizing the limitations of the modality and potential impact on diagnostic accuracy. 2. Actively employing strategies to mitigate these limitations, such as enhanced questioning techniques, structured interviews, and when ethically appropriate and consented to, collateral information. 3. Considering the client's safety and need for intervention, balancing the need for diagnostic certainty with the urgency of treatment. 4. Documenting all assessment steps, rationale for diagnostic decisions, and any limitations encountered. 5. Consulting with supervisors or peers when significant diagnostic challenges arise. This systematic approach ensures that the client's best interests are served while upholding professional and ethical standards. Question 14. What factors determine the most appropriate therapeutic approach for a client receiving telemental health services, considering both clinical efficacy and the unique demands of remote delivery? Option A. The client's expressed desire for a specific therapeutic approach, without a thorough evaluation of its appropriateness for telemental health or the client's overall situation. Option B. The availability of specific telemental health platforms, regardless of their suitability for the chosen therapeutic approach or the client's needs. Option C. A comprehensive assessment of the client's clinical presentation, technological access and literacy, cultural background, and the provider's competence in delivering specific modalities via telemental health. Option D. The provider's personal preference for a particular therapeutic modality, assuming it is generally effective for the client's condition. Correct answer is C. A comprehensive assessment of the client's clinical presentation, technological access and literacy, cultural background, and the provider's competence in delivering specific modalities via telemental health. Explanation. Scenario analysis. This scenario is professionally challenging because the BCTMH provider must navigate the ethical and legal complexities of adapting established therapeutic modalities to a remote delivery format. The core challenge lies in ensuring that the chosen approach not only aligns with the client's needs and the provider's competencies, but also adheres to the specific regulatory framework governing telemental health practice, which often includes guidelines on client safety, privacy, and the appropriate use of technology. The provider must exercise careful judgment to avoid compromising therapeutic efficacy or violating professional standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that considers the client's specific clinical presentation, technological access, and cultural context. This aligns with the ethical imperative to provide services that are both effective and appropriate for the individual. Furthermore, it acknowledges the provider's responsibility to select therapeutic modalities that can be competently and ethically delivered via telemental health, ensuring that the chosen approach is evidence-based and suitable for remote application. This proactive assessment and selection process directly supports the BCTMH's commitment to client well-being and adherence to professional standards for telemental health. Incorrect approaches analysis. One incorrect approach fails to adequately assess the client's technological literacy and access, potentially leading to a therapeutic intervention that the client cannot effectively engage with. This violates the principle of providing accessible and appropriate care, and could be seen as a failure to ensure client safety and engagement, which are often implicitly or explicitly covered in telemental health regulations. Another incorrect approach focuses solely on the provider's personal preference for a particular therapeutic modality, without considering its suitability for telemental health delivery or the client's specific needs. This can lead to a mismatch between the intervention and the client's situation, potentially compromising therapeutic outcomes and violating ethical guidelines that mandate client-centered care and competent service delivery. A third incorrect approach neglects to consider the client's cultural background and its potential impact on the effectiveness of telemental health interventions. Cultural competence is a cornerstone of ethical practice, and failing to integrate this into the selection of therapeutic approaches can lead to misunderstandings, reduced engagement, and a failure to provide culturally sensitive care, which is a critical component of many telemental health regulations and ethical codes. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's needs, preferences, and circumstances, including their technological capabilities and cultural background. This assessment should then inform the selection of therapeutic modalities that are evidence-based, suitable for telemental health delivery, and within the provider's scope of competence. Continuous evaluation of the therapeutic process and adaptation of the approach based on client feedback and progress are also crucial. This systematic, client-focused, and evidence-informed process ensures that telemental health services are delivered ethically and effectively, adhering to all relevant regulatory and professional guidelines. Question 15. When evaluating a telemental health session where a client is reporting significant and persistent audio disruptions, making it difficult for them to hear or understand the provider, what is the most appropriate immediate course of action to ensure continuity of care and client well-being? Option A. Immediately terminate the telemental health session and ask the client to reschedule for a later time when technology is expected to be more reliable. Option B. Acknowledge the audio issue, briefly pause the session to suggest switching to a phone call as an immediate alternative, and inform the client that you will resume the telemental health session once the audio is clear or the phone call is established. Option C. Continue the session as best as possible, assuming the client can still grasp the main points despite the audio difficulties, to avoid further disruption. Option D. Begin extensive troubleshooting of the audio equipment and software during the live session, asking the client to perform multiple technical checks. Correct answer is B. Acknowledge the audio issue, briefly pause the session to suggest switching to a phone call as an immediate alternative, and inform the client that you will resume the telemental health session once the audio is clear or the phone call is established. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in telemental health practice. A client experiencing significant audio disruption during a session. The professional's immediate concern is the client's well-being and the continuity of care. The challenge lies in balancing the need to address the technical issue promptly with the ethical and regulatory obligations to maintain client privacy, ensure session efficacy, and document interventions appropriately. The potential for misinterpretation, escalation of client distress, or breach of confidentiality due to technical troubleshooting adds layers of complexity. Correct approach analysis. The correct approach prioritizes client safety and therapeutic alliance by immediately acknowledging the issue and offering a clear, structured plan for resolution. This involves proposing a brief pause to troubleshoot, suggesting a readily available alternative communication method, like a phone call, and clearly stating the intention to resume the telemental health session once the technical issue is resolved. This aligns with best practices in telemental health, emphasizing client-centered care, maintaining therapeutic rapport, and ensuring the session's integrity. It also implicitly adheres to the principle of do no harm by minimizing disruption and potential client distress. Furthermore, it demonstrates proactive problem-solving, a key competency for telemental health providers, and sets clear expectations for the client. Incorrect approach is analysis. Continuing the session without addressing the audio issue, despite the client's expressed difficulty, fails to uphold the duty of care and can lead to a compromised therapeutic experience. The client may feel unheard or dismissed, damaging the therapeutic alliance. This approach risks violating ethical principles related to competence and the provision of effective services, as the core therapeutic interaction is hindered. Attempting to troubleshoot extensively during the session without a clear plan or alternative communication method can prolong the disruption and increase client frustration. It also raises concerns about session efficiency and the provider's preparedness for technical difficulties, potentially impacting the perceived professionalism and competence. This could be seen as a failure to manage the therapeutic environment effectively. Immediately ending the session without attempting to resolve the issue or offering a clear alternative plan, such as rescheduling or switching to a phone call, could be interpreted as abandonment or a failure to provide reasonable continuity of care. While ending a session might be necessary in some extreme circumstances, a blanket termination without exploring solutions is generally not best practice and could violate ethical guidelines regarding client support. Professional reasoning. Professionals should approach technical issues with a pre-established protocol. This protocol should include 1. Acknowledging the client's report of the issue promptly and empathetically. 2. Assessing the severity and impact of the issue on the session. 3. Having readily available alternative communication methods, e.g., phone numbers. 4. Clearly communicating a plan to the client for troubleshooting or transitioning to an alternative. 5. Documenting the technical issue and the steps taken to resolve it in the client's record. This systematic approach ensures client safety, maintains therapeutic efficacy, and adheres to professional and regulatory standards. Question 16. The risk matrix shows a high probability of a client experiencing a severe emotional crisis within the next hour, requiring immediate intervention. The provider's primary secure telemental health platform is experiencing technical difficulties, preventing immediate access. The client has indicated they are reachable via their personal mobile phone. What is the most appropriate course of action to ensure client safety while adhering to TMH jurisdiction requirements for secure communication? Option A. Utilize a personal social media messaging app to contact the client, as it is the fastest way to reach them and address the immediate crisis. Option B. Attempt to contact the client via a standard text message on their personal mobile phone, as it is the most direct and immediate form of communication available. Option C. Initiate communication via a secure, end-to-end encrypted messaging application that has been vetted for healthcare use and is approved by the provider's organization for emergency communication, ensuring all client data is protected. Option D. Send a standard, unencrypted email to the client's personal email address, requesting they call the provider's office immediately. The correct answer is C. Initiate communication via a secure, end-to-end encrypted messaging application that has been vetted for healthcare use and is approved by the provider's organization for emergency communication, ensuring all client data is protected. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a telemental health provider to balance the immediate need for communication with a client experiencing a crisis against the imperative to maintain data security and privacy in accordance with TMH standards. The urgency of the client's situation can create pressure to bypass established security protocols, leading to potential breaches of confidentiality and regulatory violations. Careful judgment is required to assess the level of risk associated with different communication methods and to select the most appropriate, secure option that still allows for timely intervention. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and well-being while adhering strictly to TMH guidelines for secure communication. Utilizing a HIPAA-compliant, encrypted platform specifically designated for telemental health services ensures that client information is protected from unauthorized access, aligning with the ethical obligation to maintain confidentiality. This method allows for immediate, secure communication, addressing the client's crisis without compromising sensitive data. It demonstrates a proactive understanding of risk management in telemental health, where the choice of communication tool directly impacts both client care and regulatory compliance. Incorrect approaches analysis. Using a standard, unencrypted email service for this communication is a significant regulatory and ethical failure. Standard email is not designed for transmitting protected health information, FI, and is highly vulnerable to interception, violating HIPAA security rule and the TMH requirement for data protection. It exposes the client's sensitive information to potential breaches, undermining trust and professional responsibility. Opting for a text messaging app that is not end-to-end encrypted and not specifically vetted for healthcare use also constitutes a regulatory and ethical failure. While seemingly convenient for rapid communication, these platforms often lack the robust security measures necessary to protect PHI. Data may be stored insecurely, shared with third parties, or be susceptible to unauthorized access, directly contravening TMH standards for secure telemental health practice. Relying on a personal, unsecured social media messaging platform is the most egregious failure. These platforms are inherently insecure for professional communication and are never compliant with healthcare privacy regulations. Using such a platform for client communication would be a gross violation of confidentiality, a breach of professional ethics, and a direct contravention of TMH requirements, potentially leading to severe legal and professional repercussions. Professional reasoning. Professionals should employ a risk assessment framework that begins with identifying the nature and urgency of the client's need. Simultaneously, they must evaluate the available communication tools against established security and privacy standards, specifically those mandated by TMH and relevant U.S. federal and state laws, e.g. HIPAA. The decision-making process should involve a tiered approach. First, attempting to use the primary, secure telemental health platform. If immediate access to that platform is technically impossible and the client's need is critical, the provider must then assess alternative, pre-approved secure communication channels. If no secure channel is immediately available and the crisis is imminent, the provider must weigh the immediate safety risk against the privacy risk, documenting all decisions and actions meticulously, and prioritizing the use of the most secure option available that can facilitate timely intervention. The overarching principle is to always prioritize client confidentiality and data security while ensuring access to care. Question 17. Stakeholder feedback indicates a need for clearer guidance on the foundational principles that define the scope of telemental health practice for board-certified telemental health providers, TMH. Which of the following best encapsulates the essential elements for a TMH provider to establish and maintain a compliant and ethical telemental health practice? Option A. Proactively identifying and adhering to the licensing, practice, and privacy laws of all relevant jurisdictions, providers, and patients, ensuring secure technology, and obtaining comprehensive informed consent that addresses the unique aspects of telemental health. Option B. Relying on general ethical guidelines for mental health practice without specific consideration for telemental health modalities, assuming patient consent is implied by engagement in a telemental health session, and prioritizing service volume over technological security. Option C. Practicing solely under the licensing and regulatory framework of the provider's home state, assuming all telemental health platforms are inherently compliant with privacy laws, and limiting services to conditions easily assessed remotely. Option D. Focusing exclusively on the therapeutic relationship, assuming that technological proficiency automatically ensures privacy and security, and deferring all jurisdictional legal questions to the patient. The correct answer is A. Proactively identifying and adhering to the licensing, practice, and privacy laws of all relevant jurisdictions, providers, and patients, ensuring secure technology, and obtaining comprehensive informed consent that addresses the unique aspects of telemental health. Explanation. Scenario analysis. This scenario is professionally challenging because the definition and scope of telemental health are continuously evolving, and providers must navigate a complex web of state and federal regulations, ethical guidelines, and technological advancements. Ensuring that services provided remotely meet the same standards of care as in-person services, while respecting patient privacy and informed consent across different geographical locations, requires careful judgment and a thorough understanding of applicable laws. The core challenge lies in applying established ethical and legal principles to a novel service delivery model. Correct approach analysis. The correct approach represents best professional practice because it prioritizes adherence to the most stringent applicable regulations and ethical standards. This involves a proactive stance of understanding the specific licensing, privacy, e.g., HIPAA in the U.S., and practice laws of both the provider's location and the patient's location. It also encompasses ensuring that the technology used is secure and that patients are fully informed about the nature, limitations, and risks of telemental health services, including emergency protocols. This approach aligns with the ethical imperative to provide competent and safe care, regardless of modality, and the legal requirement to practice within one's scope and jurisdiction. Incorrect approach is analysis. An approach that solely relies on the provider's home state licensing and regulations fails to acknowledge the jurisdictional complexities of telemental health. This is a significant regulatory and ethical failure because it can lead to practicing without a license in the patient's state, violating state licensing board rules, and potentially exposing the provider to disciplinary action. It also neglects the patient's right to receive care from a provider legally authorized to practice in their location. An approach that assumes all telemental health platforms are inherently compliant with privacy laws without independent verification is also a failure. Platforms may claim HIPAA compliance. Providers have an ethical and legal responsibility to ensure the security and privacy of patient information. Relying solely on a platform's assertion without due diligence can lead to breaches of confidentiality, violating HIPAA and ethical codes, and damaging patient trust. an approach that limits telemental health services to only those conditions that can be easily assessed remotely, without considering the patient's overall clinical presentation or the potential for emergent situations, is an ethical failure. While some conditions may be more amenable to telemental health, the scope of practice should be determined by the provider's clinical judgment and the patient's needs, not solely by the modality. Failing to establish clear protocols for managing crises or situations requiring in-person intervention can jeopardize patient safety. Professional reasoning. Professionals should adopt a decision-making framework that begins with identifying all relevant jurisdictions, providers, and patients. This is followed by a thorough review of licensing requirements, practice acts, and privacy regulations in each jurisdiction. A critical step is assessing the suitability of the patient's condition and the telemental health modality, including the availability of appropriate technology and emergency resources. Informed consent, detailing the specifics of telemental health, must be obtained. Finally, ongoing professional development and staying abreast of evolving regulations and best practices are crucial for maintaining ethical and legal compliance. Question 18. The control framework reveals that a BC-TMH provider is selecting a new video conferencing platform for client sessions. Which of the following evaluation criteria best aligns with the absolute priority of regulatory compliance and client protection within the BC-TMH framework? Option A. Platform's widespread popularity among general consumers and its intuitive user interface for ease of adoption by clients. Option B. The platform's ability to offer advanced virtual backgrounds and screen sharing capabilities for enhanced engagement. Option C. The platform's subscription cost and the availability of a free trial period for initial testing. Option D. The platform's adherence to end-to-end encryption standards, availability of audit logs, and the vendor's willingness to sign a business associate agreement, BA, if applicable. The correct answer is B. The platform's ability to offer advanced virtual backgrounds and screen sharing capabilities for enhanced engagement. Explanation. The control framework reveals that a board-certified telemental health provider, BC-TMH, must ensure the technological infrastructure used for telemental health services meets specific standards for privacy, security, and functionality. This scenario is professionally challenging because the provider is balancing the need for efficient service delivery with the paramount ethical and legal obligations to protect client confidentiality and ensure the efficacy of treatment. The selection of a video conferencing platform is not merely a technical choice, but a critical component of maintaining a secure and effective therapeutic alliance. The correct approach represents best professional practice because it prioritizes a systematic evaluation of platform features against established BC-TMH standards, which are rooted in federal regulations like HIPAA, Health Insurance Portability and Accountability Act, and state-specific telehealth laws. This includes verifying end-to-end encryption, audit trails, secure data storage capabilities, and compliance with business associate agreements, BA, where applicable. Such a thorough vetting process ensures that the chosen platform safeguards protected health information, FI, and supports the integrity of the telemental health session, thereby upholding the provider's duty of care and professional responsibility. An incorrect approach that focuses solely on the cost-effectiveness of a platform fails to acknowledge the significant regulatory and ethical implications of data security and privacy. This oversight can lead to breaches of confidentiality, violating HIPAA and potentially state privacy laws, resulting in severe penalties, loss of licensure, and damage to professional reputation. Another incorrect approach that prioritizes user-friendliness without verifying security protocols ignores the fundamental requirement for a secure communication channel. A platform that is easy to use but lacks robust encryption or access controls is inherently insecure and exposes client data to unauthorized access, a direct contravention of ethical practice and legal mandates. Furthermore, an approach that relies on anecdotal evidence or peer recommendations without independent verification of a platform's compliance with BC-TMH standards is professionally negligent. This can lead to the adoption of platforms that appear suitable but may have hidden vulnerabilities or fail to meet the stringent requirements for telemental health, thereby jeopardizing client safety and privacy. Professional decision-making in this context requires a risk-based approach. Providers should establish a clear set of criteria for evaluating telemental health platforms, aligning with TMH guidelines and relevant legal frameworks. This involves proactive research, seeking vendor assurances regarding security and compliance, and understanding the specific features that contribute to a secure and effective telemental health environment. When in doubt, consulting with IT security professionals or legal counsel specializing in healthcare technology can provide essential guidance. Question 19. Stakeholder feedback indicates that some telemental health clients from specific cultural backgrounds express a strong preference for therapeutic approaches that are not traditionally aligned with evidence-based modalities commonly offered by TMH providers. For instance, a client might request a focus solely on spiritual healing practices without incorporating psychotherapeutic techniques, citing cultural norms and beliefs. As a board-certified telemental health provider, how should you best address this situation to ensure culturally competent and ethically sound care? Option A. Agree to the client's request to focus exclusively on spiritual healing practices, as respecting client autonomy and cultural preferences is paramount, even if it means deviating from standard therapeutic protocols. Option B. Present a standardized, evidence-based telemental health intervention without significant modification, explaining that this is the most effective and professionally recognized approach, and that cultural adaptations are not feasible within the telemental health setting. Option C. Engage in a collaborative discussion with the client to understand the cultural significance of their preferred approach, explore the underlying needs and goals, and then jointly develop a treatment plan that integrates their cultural preferences with evidence-based interventions where appropriate, while also educating them on the rationale for recommended therapeutic modalities. Option D. Immediately inform the client that the practice is limited to evidence-based psychotherapeutic modalities, and that spiritual healing practices are outside the scope of services offered, redirecting them to other resources if they insist. The correct answer is C. Engage in a collaborative discussion with the client to understand the cultural significance of their preferred approach, explore the underlying needs and goals, and then jointly develop a treatment plan that integrates their cultural preferences with evidence-based interventions where appropriate, while also educating them on the rationale for recommended therapeutic modalities. Explanation. This scenario is professionally challenging because it requires the telemental health provider to navigate the complex intersection of cultural nuances, client autonomy, and the ethical imperative to provide effective and equitable care within the specific regulatory framework governing board-certified telemental health providers, TMH. The provider must balance the client's expressed preference with the potential for that preference to be influenced by cultural factors that may not align with evidence-based therapeutic approaches, all while adhering to TMH standards for informed consent and culturally sensitive practice. The correct approach represents best professional practice because it prioritizes a collaborative and culturally informed dialogue. By acknowledging the client's stated preference, exploring the underlying reasons for it, and then offering alternative, culturally congruent interventions, the provider demonstrates respect for the client's autonomy and cultural background. This approach aligns with TMH ethical guidelines that emphasize the importance of cultural competence, client-centered care, and the provision of services that are both effective and respectful of diverse values and beliefs. It also upholds the principle of informed consent by ensuring the client understands the rationale behind therapeutic recommendations and has the opportunity to make decisions based on comprehensive information. An incorrect approach that involves immediately dismissing the client's preference and insisting on a specific modality without further exploration fails to acknowledge the client's agency and cultural context. This could be perceived as paternalistic and culturally insensitive, violating TMH ethical standards that mandate understanding and respecting client diversity. Another incorrect approach, which is to blindly adhere to the client's request without any professional assessment of its potential efficacy or alignment with therapeutic goals, neglects the provider's ethical responsibility to offer evidence-based and appropriate care. This could lead to suboptimal outcomes and potentially harm the client, contravening TMH principles of beneficence and non-maleficence. A further incorrect approach, which is to impose a westernized therapeutic model without considering its cultural applicability, demonstrates a lack of cultural humility and competence, a core requirement for TMH providers. The professional decision-making process for similar situations should involve a systematic approach. First, Actively listen to and validate the client's expressed needs and preferences. Second, engage in open-ended inquiry to understand the cultural, personal, and experiential factors influencing these preferences. Third, assess the potential benefits and risks of the client's preferred approach in relation to therapeutic goals and evidence-based practice. Fourth, collaboratively explore alternative interventions that are culturally sensitive and therapeutically sound, explaining the rationale for each. Finally, ensure that the client makes an informed decision about their treatment plan, respecting their autonomy while upholding professional ethical obligations. Question 20. Market research demonstrates that solution-focused brief therapy, SFBT, can be highly effective in telemental health settings for certain client populations. A board-certified telemental health provider, TMH, is considering using SFBT with a new client presenting with mild anxiety and a desire for short-term goal-oriented support. Before initiating SFBT, what is the most ethically and regulatorily compliant course of action for the TMH provider? Option A. Engage in a detailed discussion with the client about the principles and techniques of SFBT, its potential benefits and limitations in a telemental health context, and obtain explicit, informed consent for its use. After confirming the client's suitability for telemental health services and the appropriateness of SFBT for their specific concerns. Option B. Focus solely on the client's stated goals and begin applying SFBT techniques, believing that the client's desire for goal-oriented support implicitly consents to the chosen therapeutic method. Option C. Proceed with implementing SFBT techniques immediately, assuming the client's general consent for telemental health services covers the use of evidence-based modalities. Option D. Inform the client that SFBT is a generally effective telemental health approach and begin using it, without a specific discussion of its nuances or obtaining explicit consent for this particular modality. The correct answer is A. Engage in a detailed discussion with the client about the principles and techniques of SFBT, its potential benefits and limitations in a telemental health context, and obtain explicit, informed consent for its use. After confirming the client's suitability for telemental health services and the appropriateness of SFBT for their specific concerns. Explanation. This scenario presents a professional challenge because it requires a TMH provider to balance the efficacy of a specific therapeutic modality, solution-focused brief therapy, SFBT, with the regulatory and ethical obligations inherent in telemental health practice, specifically concerning informed consent and scope of practice within the U.S. federal and state regulatory frameworks. The provider must ensure that the chosen modality is not only appropriate for the client's needs, but also delivered in a manner that fully complies with all applicable laws and ethical guidelines for telemental health services. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the client regarding the use of SFBT via telemental health. This aligns with the ethical principles of autonomy and beneficence, ensuring the client understands the nature of the therapy, its potential benefits and limitations in a remote setting, and their right to refuse or withdraw consent. Furthermore, it necessitates a thorough assessment to confirm SFBT suitability for the client's presenting issues and the client's capacity to engage effectively in telemental health services, thereby upholding the principle of non-maleficence and ensuring competent care. This approach is directly supported by the ethical codes of professional mental health organizations and the evolving legal landscape governing telemental health, which emphasize transparency and client empowerment. An incorrect approach that involves unilaterally deciding to implement SFBT without a detailed discussion and explicit consent from the client fails to uphold the client's right to self-determination and informed decision-making. This constitutes a regulatory and ethical failure by potentially violating informed consent requirements, which are foundational to all healthcare practices, including telemental health. Another incorrect approach, which is to proceed with SFBT without first assessing the client's suitability for telemental health and the appropriateness of SFBT for their specific concerns, risks providing ineffective or even harmful treatment. This violates the ethical duty of competence and the regulatory requirement to practice within one's scope and to ensure the safety and well-being of the client in a remote service delivery model. A third incorrect approach, which is to assume SFBT is universally applicable to all telemental health clients without individual assessment, demonstrates a lack of professional judgment and a failure to adhere to the principle of individualized care, potentially leading to misapplication of the modality and a breach of professional standards. The professional decision-making process for similar situations should involve a systematic evaluation of the client's needs, the therapeutic modality suitability, the client's capacity for telemental health engagement, and a comprehensive informed consent process. This process should begin with a thorough assessment, followed by a clear explanation of the proposed therapeutic approach, its rationale, potential benefits, risks, and alternatives, specifically within the telemental health context. The provider must then obtain explicit, documented consent before commencing treatment, ensuring the client fully understands and agrees to the proposed course of action. Ongoing assessment and client feedback are crucial to ensure the continued appropriateness and effectiveness of the chosen modality and delivery method.